Coming to the clinical relations, we can talk about sternotomy. We can talk about sternoclavicular joint. So this is the sternoclavicular joint. The clavicle is not there. So you can imagine sternoclavicular joint there. You can also talk about dislocation, fracture of the sternum, and there are two conditions and anomalies you can call. They are pectus excavatum and pectus carinatum. So these two things you can relate to the applied aspects or clinical relations of the sternum. Okay, now let's move on with the attachments of the sternum. You can see there is an attachment of sternocleidomastoid here near the manubrium, and here you have the pectoralis major, and here will be the rectus abdominis insertion. Okay, let me tell you some of the joints here. There is sternoclavicular joint. It is an atypical synovial joint. It is got the features of ball and socket type of joint, and here you can see the cartilage portion. So here is a first costochondral joint, which is primary cartilaginous joint, and you can see the sternochondral joint also. This is sternochondral, costochondral joint here, and here I said, like I mentioned before, that is the sternal angle, or you can also call angle of Lewis, this one, and this usually does not fuse, and these are the cartilages of the 3rd to 7th ribs. So this is 3rd to 7th sternochondral joints. So here you have one more joint. This one is called xiphisternal joint. That is a secondary cartilage, whereas these are the primary cartilaginous joints, but this one is a secondary cartilaginous joint. Usually it fuses by age 40. So coming to the muscle attachments, like I mentioned, just to recall, sternocleidomastoid, here is pectoralis major, and one insertion, that is rectus abdominis, and at the back you have diaphragm taking origin.